All right. Okay. Look, my name is Mythili. I'm a doctor. I'm a family physician. I'm also an IBCLC, so that stands for the International Board Certified Lactation Consultant. I've been invited by Choon Yen to do a little 1-hour presentation on breastfeeding basics. It's a 1-hour presentation. These usually take at least 3.5 hours. So I'm trying to condense everything, and I will take questions towards the end. So I'm going to try and see what I can do to get through all of these basics, just so we all have a common understanding of breastfeeding, so that we can get some questions answered towards the end. Okay? All right. So these are the things that I'm going to cover. Why breastfeed? We're going to cover a little bit of anatomy, like what does the breast look like inside? We're going to cover some of the physiology. What makes breast milk? How is breast milk actually produced? What happens inside of our breast to make breast milk happen? Okay, how to get started? Like, what are the things that we can do to get going on the right foot? Positions. So basically, how to hold your baby, which positions. I'm sure you've heard of various positions and which ones might work better for you. So this is a perennial question. How often do babies feed? And how do you know if baby's getting enough? That kind of questions, which I think Coco had mentioned before. I'll get into that right away, okay? And sleep. I'm surprised no one mentioned sleep, because sleep is something that is going to be quite precious, and whatever sleep that you get is going to be very, very hard to come by, right? So we're going to try and see what we can understand about baby sleep patterns and how you can work around those ones. And at the very end, we'll talk about support and where you can get support from. Okay. Are you guys all able to see the slides well? Yeah?
Yep.
Okay, great. Okay. So I'm going to talk briefly about why breastfeeding and why breastfeed, because breast milk contains everything that the baby needs to be able to grow, to be able to be nurtured, to be able to be healthy, right? And we are really just coming to the tip of the iceberg to understanding what breast milk contains. And formula basically tries to mimic breast milk. So whatever we can find in formula has already existed in breast milk ages ago. But what it doesn't and cannot mimic would be things that are living inside of you, like the growth factors, like your white blood cells, which provide antibodies, fighting mechanisms, anti-infective properties, viral fragments, hormones, enzymes, and pre and probiotics as well. So if you don't know what a prebiotic is, it's exactly what your probiotics, the good bacteria in the gut, need to grow. So it provides the infrastructure, it provides the architecture for these good bacteria to work inside our gut. And these things are only just being tried to be mimicked by formula. So breast milk is a far superior product. Okay. Now, for babies, breastfeeding is really the natural way of being nurtured. It contains every single thing that a baby needs to grow. In fact, WHO recommends that babies are breastfed for 6 months and beyond. And 6 months is the minimum. So babies actually don't need anything else but breast milk all the way up to 6 months. Nothing at all, right? And if you say that, yes, Singapore is so hot, I need to be able to give babies water, guess what? Breast milk actually contains 80% water anyway. So why not just breastfeed? Okay. Now, the magic of breastfeeding and of breast milk really is that it changes from day to day according to the needs of a child. So assuming we're outside of phase 2 heightened alert and you're taking a bus and someone sneezes next to you, oh my God, sneezing, COVID, right? But what happens is that infection or that bug would enter your body, and it's made into antibodies, such that that antibody is provided directly into your baby as an antibody through breast milk. So it changes every single day. If your baby is unwell, there's now scientific evidence to say that the baby's infection will transfer into your breast, into your circulation, and you'll then produce antibodies against your baby's infection. So it's a two-way street. What you are producing And what your antibodies are is exactly what's going to be given to your baby. And what baby has transfers into you, and you give baby the antibodies again. So it is really quite magical. And yes, you know, it protects your babies from infection. Okay. For mothers, it protects you against breast cancer and endometrial cancer. It protects you against a multitude of other infections that we're only just learning about. For example, type 2 diabetes, heart disease, and metabolic syndrome X. All of this is protected, and you are protected from these things because of the sheer act of breastfeeding. Okay. Now, for the diet, so a diet is your mom and baby, you know, try it as like 3 people, so diets for 2 people. It helps you bond and it helps you bring you closer to your baby. There's an attachment theory here. And after a long period of being separated, you also reconnect just by breastfeeding. So imagine if you're going back to work, and you know, we're not going to be able to work from home forever. But when you do go back to work, and you come back home, the act of you breastfeeding and taking your baby in your arms and putting your baby to your breast will be a reconnection. It's something that most mothers would look forward to after a long day of separation. Okay, let's go straight into anatomy. Now, most of you, or all of you, I would safely say, would have experienced some kind of breast change during pregnancy, and some of it would look like increase in your breast size by at least 1 cup size. You'll find that you've got these scary green veins that are appearing on your breast. You might also find that you've got some pimply looking things around on the areola. So the areola is, you know, the nipple, so part that sticks out. I'll show you my breast model. So the nipple is the one that sticks out. The areola is the area around the breasts, the nipple. And just on the outsides, at the margins of the areola, you may find some pimply looking things. And those ones are called your Montgomery glands. These Montgomery glands will produce a sticky liquid that kind of auto cleans your nipple areola complex where your baby latches on, right? And so you really don't need special wipes to clean your nipples and your breasts with. You all just need water, because when you wipe it with alcohol or anything else, you're getting rid of all of that nutritional, anti-cleaning, anti-infective properties that is secreted by your Montgomery glands. So it's probably not a good idea to use anything other than water. So no soap either. For some of us, towards the end of your pregnancy, you'll find that you start to produce a sticky kind of liquid, and that's called colostrum. And colostrum is, I'll talk to you a little bit more about colostrum in a short while, but it's sometimes some mothers start producing it towards the end of their third trimester, and some mothers don't at all, and it doesn't have any impact on your future breastfeeding experience at all. Do you also find that sometimes your nipples start to darken as your pregnancy goes along? And I mean, if you look at it, it does look like a dartboard, doesn't it? So babies know exactly where to go to latch onto the breast, right? So it's like a dartboard. Babies then eventually know how to get to your breast. So inside of your breast, you'll start to find that you're getting a bit lumpy. You might find that it's not just all soft and smooth anymore, okay? So a cross section of your breast would look like this. And each one of those little blueberry things is like your grape. That's where your juice is made. That's where your milk is made. So the juice or the milk is made in these little round fruit, and the fruit juices then pass along through those ducts into the one that sticks out right there. And that's called your nipple, okay? And all these ducts converge, and it ends at the nipple. And that's where babies will suckle, not just on the nipple, but on the areola, and babies get the milk out, okay? If you guys have any questions, please just stop me, just unmute yourself, stop me and ask, okay? All right? Otherwise, it feels like I'm talking to a screen. All right, let's go on to the physiology. Like, how is breast milk actually made? There are two main hormones at play here. One is prolactin, and the other one is oxytocin. So prolactin helps you produce breast milk, and oxytocin helps you get rid of the baby from the womb, right? So it's oxytocin is a squeezing one. It's, you know, for ejaculation as well. It also helps you get baby out of the womb, and it's also used to squeeze all those little fruits inside your breast, and it helps you push the milk along on the ducts. So oxytocin is really important. Now, I'm going to talk to you briefly about colostrum. Now, colostrum is produced in a tiny teaspoon. And if you look at the picture that that I'm showing you over here, that's 1 teaspoonful of colostrum, and that's 5 ml. In the beginning of your breastfeeding journey, mothers don't produce breast milk. They actually produce colostrum, and colostrum is only produced in teaspoonfuls, never in a bottle full. Okay. Now, this is liquid gold. When babies receive colostrum through breastfeeding, it lines all the way from the gullet all the way down to the stomach, small intestines, and the large intestines. And it provides a thick membrane that helps protect baby from future infections. Now, this is also a very strong laxative that helps to clear all of the baby's meconium. And meconium, I'll show you a picture of later on. It's a thick, extremely hard to clear of poop that baby produces in the first couple of days. Meconium is thick and very, very hard to remove. So colostrum is a very strong laxative. It helps to get rid of that. Now, if your baby, and honestly, 60% of jaundice babies, actually no, 60% of Asian babies have jaundice. So if your baby has jaundice, this colostrum is going to be so very important because it helps baby poo out all of that bilirubin, and it helps to clear the jaundice much faster. Okay. Now, eventually, on day 3, so day 1 you'd have colostrum, day 2 you'd have colostrum. On day 3 or day 4, sometimes up to day 5, that's when you start to have a huge amount of change in your breast, and you'll find that eventually it's going to get so hard and so firm that then your milk is going to start coming in, and that's when you start producing breast milk. Now, you only start producing breast milk when your placenta is effectively removed from your uterus. So baby comes out, and then eventually you have your placenta coming out. That is a trigger for the production of breast milk, and that's a trigger for your prolactin levels to go surging up into the skies. Okay, so if that is a problem and you haven't had a lot of your placenta removed for some reason or another, then some mothers actually find a problem in their milk coming in. Okay, so when I mentioned oxytocin and how oxytocin is the pushing hormone, like it pushes the baby out of the womb, it pushes sperm up, right? As well, because it is the hormone of ejaculation. It also pushes the milk that comes out of your breast. Now, it's called a letdown reflex, not because you're going to be crying when it happens, but it's basically how the milk tap gets turned on. So if you have seen babies suckling at the breast, so they don't nipple feed, they breastfeed, so they suckle most of the areolas inside the baby's mouth. They go suck, 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 and then the milk tap turns on, and then it starts to flow. Then you hear babies suck changing into a swallow, be gluck, gluck, gluck. Only when you start to turn on the tap, that's when you actually start to flow, milk starts to flow through the ducts and get into your baby. So milk doesn't flow unless the milk tap is turned on. And the milk tap is only turned on if baby's suckling effectively at the breast. Okay? The magic of breastfeeding, yet another magical piece of news, is that the more frequently milk is removed from the breast, more milk is made. Okay, so as long as milk is removed from the breast, more milk will be made. So that's something, it's magic. You just cannot forget it. If you are having worries that you're not producing enough milk, that's it. You just have to put your baby to their breast more often, and it will happen most of the time. As long as babies put onto the breast and babies suckling effectively, you'll be making enough milk for your baby. All right. I'm going to show you a beautiful video, and this is what your baby is going to look like when babies are born, okay? It's a beautiful video. Enjoy this. So did you see that? How the baby actually knows exactly how to find the breast? It's like if you've ever seen a video of puppies and their mummy, right? So the mummy doesn't actually carry the puppies and put them into position. What the mummy dog does, the mom dog basically lies in the middle of the pen, and all the puppies start to crawl, find their way to the baby, to the mother's teeth, and start to suckle. The mother's not going to be there to cradle and hold the baby in different ways. Now, this happens if your baby is skin to skin with you. And that just means that your baby's shirt is removed. You can leave a diaper on if you wanted to. And you see how the mother's not fussing around with a little slit for a dress where baby has to find the way to the breast. The mother's shirt's off, the bra's off. And that's skin to skin. When you are skin to skin with your baby, babies know how to get onto the breast. All you'd have to do is to place your baby on your chest, and babies will instinctively use their stepping reflexes, their sense of sight, their sense of smell, and they will be able to find the way to the breast. In fact, studies show that when you have your baby skin to skin and you're sitting back and you're just laying back on your chair or the bed, babies are able to get a really good latch on, way better than if you're struggling to carry your baby with your arms, right? So we always say bring your baby to the breast, not the breast to the baby. So that's how you get started with skin to skin. Now, what we often say is you need to get informed, and that's my duty here, giving you this little lecture. Okay, I'm trying to get you informed about why you want to breastfeed and how to get started. You want to create a birth plan and a baby care plan, because as much as you know things, if you don't plan, you plan to fail, right? If you don't plan ahead, you plan to fail. So you want to start thinking about how you want to what kind of a birth you want and how you plan on feeding your baby, and speak to your doctors about this, speak to your obstetrician about this. And if you find that your doctor is saying, don't worry, we'll talk about it when the time comes, then you might want to think again, is he planning on doing this himself, or is he working with me to have the plan that and the birth that I want? Because that's what you're going to remember. You're going to remember your birth. Your doctor's not, right? So you want to plan and you want to be able to have the birth that you want. Of course, some things may happen along the way, but like I said, if you do not plan, you plan to fail. So know what you're set up for, okay? This is called the BFHI, the Baby Friendly Hospital or Health Initiative. Now, these are a set of 10 steps, and these 10 steps are for you and your baby to have a successful breastfeeding journey. It's a WHO, UNICEF, and MOH driven initiative, and it's 10 out of 12 maternity hospitals are certified. Okay, so all the public hospitals are certified. Some of the maternity hospitals in Singapore are certified. There are only 2 that are not, and these are the private hospitals. Okay, can't tell you any more about them. But what they will do is they will encourage you to have skin-to-skin contact right after birth. As soon as your baby emerges from your womb, they are going to give you 60 minutes, 1 hour of uninterrupted skin-to-skin time, where you and your baby will have this magical moment of reconnecting, and you would have the first look and the first touch of your baby. How magical would that be, right? And you'll be shown how to breastfeed. So basically, you would just have your baby on your chest, and your baby will find the way to the breast. You can start to breastfeed at that moment. Yeah. In BFHI hospitals, there'll be no bottles, no teats, and no pacifiers. And they're going to help you get breastfeeding the right start. There's also something called 24-hour rooming in, and that really just means that your baby is not going to be separated from you. You're going to have your baby with you the entire time, and you're going to be taught how to feed your baby on his cues, how to watch for his signs that he's getting hungry, how to get your baby, how to hold your baby. All of this is going to be taught to you. And if it's not taught, demand for it to happen, because you're going to go back home with your baby and you're going to have to deal with all of this by yourself, right? So you need to know. So encourage yourself, encourage the doctors and the nurses to ensure that these things are taken care of before you leave the hospital. Support, 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 because there's nothing about BFHI that will go on well without support. And that's the step 10. And I'll talk you more through that later on. If you can hear my dogs, they've gone a bit cuckoo. They're barking quite loudly. I apologize about this, okay? Now, how was baby in the womb? While baby was in the womb, the baby was fed all the time. It was a steady flow of food from the placenta into your baby's circulation. So while the baby was inside the womb, the baby has never known hunger. He has never known cold. He has never known what darkness or what light is. He's never known the whole feeling of clothes or even a diaper on him, right? He's never even felt what pee would be like, because suddenly you feel cold, right? When pee emerges from your body and sticks onto a diaper. And he wouldn't have known what it feels like to fart or even to poop. All these sensations are brand new to your baby. Okay, so because there's so many things that change as soon as he's born, we need to try and understand that because there's so many things that are new, he's going to have a rough time. Okay, so we try and make the transition from the womb to the outside world as comfortable, as smooth as possible. All right, and how we do that is, before that, how is baby right after birth? Cold room, bright lights, rough hands, sudden separation from your baby, from the mother. There's new feelings of hunger, cold, clothes on skin. These are brand new experiences for your baby. Of course he's gonna cry. Which baby wouldn't cry with all of these, right? So what we try and do is we reconnect, and we allow reconnection to happen with a breast crawl, like what you saw just now in that video, that very short video, placing the baby on the mother's chest and getting the baby to find the breast and latch on his own, because that shows you that your baby will be able to find your breasts. Okay. As soon as your baby is placed onto your skin, it's amazing, but you will calm down and your baby will calm down. In fact, in hospitals where they are lacking or they just don't have enough incubators, they put babies onto their mother's chest. And this is a heating pad. Your chest will warm up or cool down depending on baby's temperature. And it's amazing. So we call it kangaroo care. In the first hour of your baby's birth, they are the most alert. We call it the golden hour. So if you can grab onto that 1 hour and not share it with anybody and have your baby skin to skin on your breasts right in that very first hour, that's going to be the first immunization that your baby is going to be receiving, because he's getting all of that colostrum that's going to line all the way from the mouth all the way down to the gut. And that's going to be the first immunization that your baby's receiving. And if you think about it, as long as your baby's on your chest, the infection risk is cut down dramatically. Think about hospital hands. You know, now that we are in the era of COVID, we know how dirty our hands can be. And every time you have a baby on your chest, no one's going to come and touch your baby, right? So that's reducing infections. And you know what? Doctors' hands are the filthiest. Doctors and nurses and all the other medical professionals. So you want to cut down on those infections as much as you can. So keep your baby on your chest. Now, let's talk about how often babies feed and what their feeding cues are. Okay, let's look at the pictures on the left. As soon as babies wake up and they start to look around, start to wake up, have little movements here and there, mouth opening, just looking, that's an early cue that I'm hungry. Maybe you want to pick me up and feed me right now. Once they start having bigger movements like stretching and moving your hands to their mouth, that's already, I'm really hungry. And once they start crying, they're really hungry. You really got to pick them up, calm the baby down, put this baby skin to skin if possible, and then feed the baby. Okay, because babies have a tiny marble for a stomach, and I'll show you a picture about this in a short while. Their stomach size at the beginning is only just about 10 to 30 mLs. So their tiny marble for a stomach will need to be fed very often. And if you think about it, human milk is so easily digested. Human milk for human babies, yeah? So it's easily digested, and so babies need very frequent feeds, at least 8 to 12 times or more in 24 hours. So at least every 2 to 3 hours. That's as much as babies need to feed. Now, of course, the next question is, if my baby needs 14 feeds a day, am I overfeeding my baby? The answer is no, because when babies are breastfed, they will only take in what they need. It's very hard to overfeed a baby who is breastfed at the breast. Okay, we always say in the first 4 to 6 weeks, avoid all bottles, all teas, and all pacifiers because it does change the way the babies suck on the breast. So again, the mantra is the more frequently milk is removed from the breast, the more milk will be made. So there's no reason to be afraid that you're not going to have enough milk for your baby as long as you're breastfeeding at the breast as often as you can. Okay. One more thing that I need to add on, sorry, just before we go on to the next slide, is when we swaddle a baby, you're going to be mimicking this. You're going to be mimicking this picture. Can you imagine that when you swaddle your baby is going to feel cuddled, warm, squished up, and feeling very comfortable? And when babies are squished up and swaddled, they're going to sleep a lot more. So if you're worried that your baby's not taking in enough and you're worried that your milk supply is not up to scratch, you want to remove the swaddles. You want baby to be skin to skin with you. And that's an important point. I want you to remember that as well. Okay? All right, let's move on to this. In the first couple of days of your baby's life on earth, we always say nursing on demand, nursing on cue, putting your baby to the breast as often as possible. That's how you will start to build your breast milk supply. And if you count those milk drops, that's 2, 4, 6, 8, 10, 12, at least 8 to 12 times. Okay? Here are the breastfeeding positions. There are so many positions, honestly, I lose track of all these position names, but that's right up here. I do believe that's your cross cradle. That's your football because you're holding like American football, holding your football right down there. That's your cradle. That's cradle, cross cradle. That is side lying, I believe. Yeah. And that's laid back breastfeeding. You know what? Forget the names, right? It's not important. You and your baby are like puzzle pieces. Not every two puzzle pieces fit exactly, but you and your baby have to learn that dance. You have to learn your positions. You have to learn which ones work for you, which ones don't work for you. And you can only do this with your baby. In fact, out of all my 3 babies, I think each one had their own preferred position, if you want to put it that way. Okay, I had different preferred positions with each of those babies as well. So the one that works the best is where both you and your baby are comfortable. My favorite, and what I often show mothers and teach them how to work with, is this laid back position. And it's called the biological nursing. And this position, ideally, this is where your shirt is off and your baby's onesie is off and you're both skin to skin with each other. We find that your baby's reflexes are primed. They're primed to work for you. So the rooting reflex is where you tickle the baby's mouth and they go, that's the rooting reflex. The stepping reflex is where baby's feet, as long as they come in contact with something, they're pushing off. The suckling reflex, as long as something is in the baby's mouth, they will suck on it. They will suck on a finger, they'll suck on a earlobe, they'll suck on a shoulder, they'll suck on a toe. They will suck on a bottle. Okay, and it's got nothing to do whether the baby's hungry or full. If you put anything inside a baby's mouth, they will suck on it because it's a reflex. And if something is filling up their mouth, With milk, they will swallow it. So if that's the case, if you are feeding your baby at the breast and someone offers the baby a bottle, the baby will finish it. And it's got nothing to do with baby's hunger. But what you're doing then is you are compromising on your milk supply. Because if you're giving baby something else other than your breast, the next feed, baby's not going to be as hungry, and so doesn't take as much milk from your breast anymore. And then what happens is, because milk is not removed from your breast, you'll start to make less milk. So probably not a good idea to introduce anything other than your breast for at least the first 4 weeks. Okay, when you have your baby skin to skin with you like this, your baby will be able to smell the amniotic fluid, because the Montgomery glands that I spoke to you about earlier just now, those fluids actually smell just like the amniotic fluid in your womb. So because they instinctively know how to get a good latch, all you'd have to do is to keep your baby tummy to tummy and baby's chin into the breast at the same time. So how we know if baby's latched on well? Your baby's mouth is wide open, more than 120 degrees open. The cheeks are well rounded. They're not sucked in like bubble tea sucking. No, it's not like that. They're really well rounded. You'll find that in this picture, you can't see much of the mother's areola. But can you see that your baby's chin is really in the breast? And they always have your heads up a little bit. You know, you can't drink physically, you can't drink if your chin's down there. You can only drink if you're tilted up. So in the same way, your baby's chin needs to be in a sniffing position. Okay, you'll know if your baby is actually getting milk if you hear swallows. So they go suck, 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 suck. Once the milk tap is turned on, they'll go suck, swallow, suck, swallow. We know if it's a good latch or a good attachment if it is painless. Breastfeeding is not meant to be painful. And if there is pain, you need to unlatch your baby and put the baby back on to the breast again. Okay? And remember, the mantra again is tummy to tummy, chin to breast. So your baby's belly button cannot be facing up in the sky. You got to turn your baby such that the baby is tummy to tummy with you. Now, you don't nipple feed, you breastfeed, right? And most of the milk ducts, which needs to be coaxed out, is at the areola. So if you look at this picture here, this is actually the areola. This baby's only nipple sucking, right? So this is a poor attachment. You want the baby to be able to get a good amount of the areola into the baby's mouth, and the nipple is all the way far back at the junction of the hard and the soft palate. So in this way, there's no chance of nipple damage, okay? So every time you have pain, every time it's uncomfortable, you unlatch your baby and you get your baby to latch back on again. My favorite topic, pees and poos. So we know if baby's getting enough because we'll be able to find out how many pees and how many poos is baby producing. So very simple. This I think what I'll do is I'll get Choon Yen to send you the link of where you can get all of these infographics, because I think these are amazing. They're produced by the Breastfeeding Mothers Support Group, and I'll share them with you in a while. On the first day, we expect one wet nappy and a sticky black tarry stool called meconium. On day 2, we would tend to see 2 wet nappies and 2 poos. And this poos will tend to be sticky and dark sometimes, or they'll start to be changing into green, almost like pea soup. You know, if you have frozen peas and you blend it, that's what it's going to look like, typically on day 2, day 3. By day 3, that's when you start to have your milk coming in, and you'll find that your breasts are hard and engorged and you've got so much of milk inside of your breast. That's what happens on day 3. And you'll find that by then, your baby's poop will start to change color, almost brownish, greenish, or yellowish, right? By day 5, we should see 3 to 6 poopy diapers and 6 to 8 wet diapers in 24 hours. If we see that your baby's poops are changing, we know that your milk is coming in, and that's not an issue anymore. Okay? This is a really handy infographic, and we often give it to mothers who attend the BMSG workshops, but we'll make sure that you get a copy of this on at least an image of it. Let's talk about sleep. Now, we've got lots of mothers who call in and say, my baby's not sleeping. And when my baby's not sleeping, I'm not sleeping. Now, I often remind mothers that babies sleep when they're comfortable. In the first couple of days, they have no idea what they've gotten themselves into. They were very perfectly comfortable inside of the womb. And it's suddenly when they're snatched out of the womb or they've been born out of the womb, they have no idea what day or light is. They have no idea that at night's meant for sleeping. They just don't get it. And in fact, some babies don't get it up till a long time. So what we try and do is we try and stimulate the melatonin production. So in the daytime, if they're having a nap, we leave the curtains open, right? So that they get the melanin production kick-started, hopefully, and they understand night and day better. But if you think about it, night feeds are essential because babies receive almost 60% of their milk feeds and their food at night. And so you need to feed at night to be able to make a good supply. The other thing is, do you remember the two hormones I spoke to you about, prolactin and oxytocin? Prolactin is produced maximally in the middle of the night. So we want to make sure that babies are suckling, or at least milk is removed in the middle of the night. Okay? And baby wearing. When you carry a baby like this is my third baby. I think he was about 9 months or so. It helps to calm the babies down. It gets them close to you, and it kind of almost mimics the womb. So baby wearing is handy. And if you have the chance to attend a baby wearing workshop, I do believe Choon Yen mentioned that there is a baby wearing lecture in the postnatal series. So do sign up for that if you can. And I think it saves a lot of my arm strength. So this is something I totally recommend as well. I'm coming to the end now, so hang in there. I'm going to get questions from you in a short while. But there is breastfeeding support available to you. And you have to go out and look for it sometimes. In Singapore, that's how it is. You know, people don't come knocking on your door. You have to go out looking for it. So find a mother group, find support groups like the BMSG, and the BMSG stands for the Breastfeeding Mothers Support Group. It's a charity, it's a free service, and they man helplines, they man WhatsApp helplines as well. There's a Facebook support group, and there's always a La Leche League, there's this new mother support group. Find medical professionals who understand breastfeeding, like an IBCLC. Some pediatricians are very breastfeeding friendly. Some GPs are extremely breastfeeding friendly as well. And get online, get on social media. There's a wealth of websites and social media accounts which are dedicated to breastfeeding as well. So find support that suits you, okay? And that's a quick shout out. That's for the Breastfeeding Mother Support Group. And that's the helpline, okay? So you can call the same number, you can WhatsApp that number at the same time, and you'll be able to get support that way, okay? Hang on. Oh, okay, Choon Yen just sent out a little message about the postnatal care. That's the Facebook group, and that's the website, okay? We search for the Breastfeeding Mother Support Group, or the BMSG. And that's a quick shout out for who I am. And that's my website. I do have links over there where you can actually be connected to me if you want to get breastfeeding support or just help you answer some questions at the same time. Okay. And that was my birth. That's a picture of my third baby being born at home, surrounded by my mother and my husband, and my doctor would be like just in front of me. I've had a doula support as well. So this little baby, who is now 7, was born at home in the water, hypnobirth at the same time. So yeah, these are my take-home messages. Know why you want to breastfeed and get your support team sorted, okay? Basically get to know why you want to do this and why it's important to you. Skin to skin as soon as possible and as frequently as possible, because this helps you reconnect with your baby, okay? Frequent feeding, because frequent feeding means lots of milk. Night feeds are so important, so please feed your baby at night. Rooming in, keep your baby with you 24 hours a day so that you can feed your baby as soon as your baby asks for a feed. Okay, and how do you know if you're making enough milk? Is to find out what your baby's putting out. So your input must be equal to your output. If your baby's peeing as much as your 6 to 8 wet nappies, producing 1 to 3 dirty diapers every day, then you know you're making enough milk. Laid back breastfeeding is my favorite position, and I would encourage all of you to try it out and get support ASAP as soon as you possibly can, because that support is going to give you the breastfeeding journey that and get you both in the right start from the very go. Okay. And that's all I have to share with you. I would love to take questions. So if you can, please unmute yourself and ask away.
Yeah, hi, Jess here.
Hey, Jess.
So you mentioned, yeah, hi. So you mentioned that as much skin-to-skin contact for the breastfeeding is the best, especially during like the first month or the first 2 months. But at least for like the night feeding, if we are to use a confinement nanny, do you think it's okay to bottle feed the baby once in a while so that we can have some rest, at least at night?
Okay, it's a good question. But do you remember what I said about night feeds and how the prolactin levels are highest at night? So if you're not breastfeeding at night, your breasts are going to get engorged and your milk ducts will still continue making milk. But if you're not going to remove milk, you are running the risk of blocked ducts, engorgement, mastitis, and it's a very slippery slope. So what mothers often do is then they'll start to pump. And you know what? Facing a machine in the middle of the night versus feeding your baby in the middle of the night are two different experiences. One actually involves you getting out of bed, it involves you sitting upright, it involves you getting this cold, hard machine. And it takes you about 20 to 30 minutes of feeding, of removing breast milk from from your breast, versus a close cuddle with your baby, smelling your baby's beautiful hair, giving him a nice, lots of kisses, because that's, when you have this love going on between you and your baby, your milk tends to flow. You will never have that love for the same way with your breast pump. So you find that your milk supply does not work the same way and does not respond the same way with your breast pump as compared to your baby. So we often suggest, if you, I would strongly urge you to get your confinement nanny to bring your baby in bed with you, allow you to feed your baby, and then the confinement nanny can go burp the baby, change the baby, do whatever else she wants to do. But get your confinement nanny to work for you. I would suggest that's what you probably want to start doing from the very first go.
Okay, yeah, thank you. That makes sense.
Yeah.
Um, yeah, just another question that I have is there any food or drinks that we need to avoid during breastfeeding? Because been told to reduce caffeine, for example, during pregnancy, because it's not really good for the baby. But what about during breastfeeding? Is that okay to to take like coffee or tea once in a while, or is that
Absolutely. Look,
not good for the baby?
caffeine is life, isn't it?
Yeah, it is.
Honestly, caffeine does make your baby awake. Just like how it keeps you awake, it keeps your baby awake as well. So if you wanted to have anything that contains caffeine, I would suggest you have it in the morning and have it after your baby has had a feed, so that the levels of caffeine will start to reduce with your metabolism, right? So your breast is also living tissue. As long as your breasts are making something, your metabolism will start to break down caffeine into something else, and it will not act the same way if you're breaking down the caffeine. So if you're going to have your coffee, have it right after your baby's had her feed. Okay?
Okay, thanks.
No
Well,
worries.
that's good. At least I can still have coffee.
Of course you can. Coffee is life. I think you had some questions about engorgements and blocked ducts and everything. That typically happens when babies are missing on a feed or when you are pumping. Because if you think about it, remember what I said just now with your questions is, when you're pumping, you don't have as much love for the breast pump as compared to the baby, right? And when you don't have as much love, your oxytocin doesn't work as well. Okay, now you need oxytocin to push the milk out of your breast glands, right? Just like how your oxytocin would work to help you ejaculate or even to get your baby out of the womb. When you don't have that much love for your breast pump, it doesn't clear the breast ducts as well. So it's really important, if you want to try and avoid engorgement, to keep your baby onto your breasts. Okay, I hope that answers your question, Sing.
Hi,
Yep.
Coco here.
Coco, yes.
Yes, so I have two questions. One's
Mhm.
regarding the breast pump. I mean, is there any situation you have to do the breast pump? Like some mommy probably have too much milk and baby is
Oops.
don't need that at this moment, so they have to breast pump out and keep in the storage bag.
Okay. Mothers produce more milk only in two situations. Okay. Can you see that? Okay. When mothers start to pump out the milk, they're going to start to produce more milk than necessary. Right. So if
Mm,
you use the haka or the letdown collectors, which I'm sure you guys all have bought already, if you bought a
yeah.
breast pump, if you have all of these things, I'm going to suggest you do not use them
Mm,
unless you are separated from your baby for whatever reason.
mm,
Sometimes babies need to be in hospital. Sometimes babies, or you have to be in a hospital and away from your baby. That's the only time I would encourage you to take out your breast pump and start to remove milk. Because if you stop removing milk from your breast, you're not going to be making any more milk. Simple as that, right? So if you ever need to take out the haka, I'm going to strongly urge you not to, because what it does is it removes a lot of the watery parts of the milk and it leaves the fat behind. So I didn't show you this because I was really worried about time, right? But your breast milk works like this, okay? The first couple of sucks, if you have a 20-minute length of breastfeed, the first couple of minutes will be the thirst quenches, like your appetizer almost, right? Like a drink of water before the milk comes out. Then let's say the next couple of sucks would be your main course. So that's your pasta, your rich, hearty bolognese or your lasagna or whatever it is. And then the last part of your breastfeeding would be your melting chocolate lava cake, the cream, the ice cream, the filling bits. And that's all of the fat. So as the feed progresses, the amount of fat increases. When you have a haka stuck onto your breast, you all know what a haka is. Those letdown collectors, it looks like a suction cup that you can stick onto your breast. Um,
yeah.
when you have these things, it removes a lot of the watery parts, but it leaves the fat behind. And when fat is stuck in those ducts, that's when you get a blocked duct. Okay. And
Mm.
in my clinic, in my experience, I've seen hundreds of mothers who come in with blocked ducts because of these little gadgets. So I'm going to strongly urge you to not remove any milk from your breast as much as you can until week 4.
Okay, thanks for the tips.
No
So
problem.
the second question is, do we need bring any bottle or spoon to the hospital for collect the cholesterol?
If you're collecting colostrum, I would say if you are having some kind of medical conditions like a gestational diabetes or preeclampsia or anything else of that sort, then I'd say start collecting colostrum towards the end of your pregnancy. So in the last couple of weeks, you could start collecting colostrum. If you if there's any reason that babies are going to be separated from you for whatever reason, maybe the baby needs light therapy, maybe the baby has got some kind of problems with breathing, then I'm going to urge you to ask the nurses for syringes to collect your colostrum. Or they even have little tubes which you can collect your colostrum in. Okay, the hospital will be able to provide that. So there's no need for you to bring your breast pump. There's no need for you to bring anything at all to the hospital. In fact, if your hospital is baby friendly certified, they won't even ask you to use a bottle. They'll use a syringe, they'll use a cup, they'll use any other means or even a spoon other than a bottle.
Mm.
Okay.
Okay, thank you. That's all
Um,
for me.
all right. Thank you, Coco. I think there's some questions up here. Jess, is it? Hang on. What if we're in the midst of breastfeeding and there's some milk leaking down. That's why mothers use the haka. Okay, when you look, that milk that leaks is like your SK2. It's amazing for your skin. What if you're worried about leaks? All you'd have to do is use your forearm and press onto the breast a little bit, okay? Or use a tissue, use a handkerchief, just hold on to your breast for a bit and it'll stop the leak right away. That leak is not a problem. That leak is normal, it's physiological, and it's really good for your skin and for your baby's skin. So there's not an issue there, okay? Honestly, these things are made because they're clever. They have created a need when there's actually no need for such a product at all. So I know they're clever, aren't they? So just know, I'm sorry, I don't buy it. I don't think there's a reason for the haka for that still. Any other questions, guys? No? We've got 2 more minutes. You can ask any other questions that you like. You can unmute yourselves and just ask away. No? Okay. Look, if there are no questions, what I'm going to urge you to do in the next couple of days is to get in touch with this website, the breastfeeding.org.sg. If you went on to resources, you'll find all of the infographics that I've shared on this talk. You'll find most of these pictures up on that website as well. So click on, find it, and download it, and you stick it everywhere that you really need to. Okay, and keep that number on standby as well, because that's a really good number to keep for any breastfeeding support at the same time. Okay. Otherwise, if you need to get in touch with me, that is my website, so drmythilipandi.com, and I'll be able to help you if you have any further questions at all. All right, perfect. Is there anything else? Any last minute questions? No? Okay, perfect. Choon Yen, are you there?
Yeah, we just end the session, right?
Yes, we can end the session.